Welcome to Live Hospital. My name is Merdan FAYDA. I am a radiation oncologist. I am working radiation oncology about, I can say, 15 years. Today I want to talk about our high-end machine. Name is Turbium STX or Turbium STX. STX means this machine can do stereotactic radiotherapy. This machine can treat stereotactically patients. So if your patients need sometimes gamma knife, cyber knife, you may know those things. This machine can most of the tumors for stereotactically. Of course, the big areas in stereotactic radiation, the tumor most of the time is very small and tiny tumors, like 1 to 3 or up to 5 or 6 centimeters. We can treat it with this machine. What this machine can do is, this is a normal multi-leaf collimator of a Linux, and this is our multi-leaf collimators. You can see 0.25 millimeters in thickness, so it's very, very tiny. What does this mean? It means this is brain, this is the tumor where we want to irradiate. As you see, the dose is very condensed on the tumor, and the dose is very clearly decreased after the tumor is irradiation. It's very important for our normal tissues, so we can easily spare normal tissues, and normal tissues, there is no need for radiation for them, so we just treat the tumors, and normal tissues got very, very, very tiny and little doses. We are using this machine for brain mets, for meningiomas, for acoustic schwannomas. Most of the tumors, like for treating with gamma knife, we can treat here. And we have a distinguished feature from gamma knife is this is a thermoplastic mask. This mask is completely look like our patient's head. It's in the beginning it's heated in the water, and then come to shape of our patients. So as you see, gamma knife has some pins. You may know some holes and pins, so it's uncomfortable machine. But this machine, we are using same radiations like gamma knife, but there is no pinholes. Patients just lie down comfortably, and the machine and our tables and the machine going around her or our patient, and the patient treated very comfortably. How can we do this is, I can say, this picture is for this. This is a prostate case. You see there is 2 pictures here already. You cannot see 2 pictures because they look like one picture. One picture is coming from computed tomography. This machine can get a computed tomography here. We call it COM-beam CT. Those device is COM-beam CT. So we can get the patient's tomography here, and we can combine each images from both coming from tomography and both coming from computed COM-beam CT, and the patient movement under the 1 millimeters. And it is exactly how can the patient stabling like CT, and this is the same position for CT. Our planning's all from coming CT, and the patient treated very safely. The patient come to our room. It's very comfortable, and as you see, it's very cool and great area.
That's scared.
yeah, a little bit scary, but after the 1 day, you will be okay in here. Patient come here, lay down. First thing is our patient positioning is okay or not. We use COM-beam CT, and then the treatment began. When we sure that the patient is not moving and the patient is same position, when we use COM-beam CT, then the treatment began. We can say about 10 minutes or 20 minutes the treatment is done. And this machine also, why Turbium? This is I can say, very speedy machine. Speedy thing is very sometimes important. Some patient is not very comfortable, although it's comfortable, but some patient cannot do it comfortably. So this machine can move quickly and can irradiate patient in the brain tumors, in brain metastasis, in lung metastasis, in liver metastasis, in some surrenal metastasis, some bony lesions, some, and some people with 3 or more bone metastasis can treat it in one come here and just 10 treatment. You can treat 10 days the patient, and most of the time it's a comfortable treatment. After treatment, you can come another country from here. Of course, your country is Bosnia. You come here and you're treated. Then after treatment, you can go to your country. Most of the time, of course, there is some side effects with radiation, but this is not most of the time. How can people come here, can go to a country? So it is radiosurgery. We can say this machine can do this radiosurgery thing. Although it's a surgery, there is no impairment of patient general condition most of the time. It's like getting a computer tomography. You know, it's an X-ray machine, but it is non-invasive procedures. Mostly, is this invasive? This is just your patient positioning. This is patient positioning, and this is completely non-invasive procedure. So you cannot understand the X-ray go inside and outside to you. So this is why it's like a castle-like place, because you cannot hear. The patients should be alone here. Sometimes some patients cannot very communicative with us, like children sometimes come here, maybe 3 years old. We still radiation may need it. So we are using anesthetic equipment coming here, and they just relax the patient. Sometimes the patient is just sleeping. If it's really necessary, we can do like that sometimes for most of the time littles, or some patients, due to their brain lesions, they cannot communicate you, so we can sometimes anesthetically we can sleep them. So it's not a hurting device. Of course, every treatment has some side effects. You know, effects and side effects are very, collaborative. Of course, there are some side effects, but I can say, as the features of this machine is, the side effects are very, very cool, because we are just treating what we want to irradiate, and our patients' normal tissues is not irradiated very well. So we can spare the organs, like I can say esophagus, I can say the mucosal area. We can do our best for spare their normal tissues. So if you treat just their tumor, not much as the normal tissues, and the treatment become very comfortable, and patients like the treatment. So of course there's some side effects, but mostly challengeable, and it is not a difficult. Tumor is inside the patient, of course, and the question of yours is very important. Where is your tumor? If your tumor is very near the, like I said, tongue, and you irradiate the tumor, and the tongue gets some radiation, and you can understand there's some thing on your tongue or like that. Okay, so where are you radiating? Some irradiations are very easy to do, because there is no very radiosensitive structures. Like I say, if there is a bone lesion in the pelvis, and there is no, if the bowels is not very near there, so you can easily irradiate this patient without any important side effects. But if you treat a tumor is very near the eyes, so patient eye or patient cranial nerves, patient optic nerves get some radiation, of course, and this is what our specialty is, dealing with daily basis, and of course this is our specialty, and we do our best to patient has minimum side effects. This machine can treat the bigger target. Bigger targets is easily, like I say, if you treat a breast, this is not a the very pinpoint kind of radiation, because the breast tissue is enough very, very big. This machine can treat the big tumors easily, but if your target is small, like 1 centimeter or 0.5 centimeter lesion in the brain, and very near the, let I say, the brain stem, let I say the optic nerves, it's very near. But if this machine still can treat those things. So it's a very good scale. Big tumors, large targets can be treated easily, very fastly, very precisely, and the small tumors can also be treated. And I can say we can treat if anybody needs radiation, this machine can do most of the radiation they need.